All right, good afternoon, everybody. Here with Josh and Paul, of course, and Melissa McCall, our amazing Secretary of Office and Policy and Management, since this has been a big week for the Connecticut budget over the next 2 years. So happy to take your questions there. But first, let me give you a quick COVID update. I think what's relevant here is still a lot of testing. Our positivity rate, 2.3%. That's the lowest it's been in 3.5 months. So that's a trend line that's gone on now for some weeks, and that's extraordinarily positive good news. New York's about 3.5%. They're beginning to go down as well. So this is happening nationwide. Let's make sure this time it's permanent. Let's make sure the vaccines make it permanent. Hospitalizations are down, so we have good capacity there for any type of surgery you may need. Fatalities, a lagging indicator. We have some work to do. The vaccine update, still doing very well nationwide in terms of the percentage of our population who've been vaccinated and in terms of the number of doses, percentage of doses that get a shot in the arm. 61% of the 75 and above have been vaccinated, 13% of the 65 and above, 65 to 74 have been vaccinated. That's some of those were in the nursing homes, but that's a population that's ramping up quickly. I do got to tell you that there's about 300,000 people still in the 65 and above category that have not been vaccinated, and we're only getting about 69,000 vaccines a week. So this is going to take a little more patience, but I'd like to think those number of vaccines could ramp up in a couple of weeks. And so far, so good. 580,000 doses administered to date. Let's move over to the budget, just because this is a big week. Melissa's been briefing the House and Senate, the leadership, some questions from the press today. We laid out our priorities, our goals in a speech on Wednesday. Number one, just the segue, if you don't defeat COVID and break the back of this virus, nothing else matters. Our budget and economic growth will be topsy-turvy. We're breaking the back of COVID. Number two, a more affordable Connecticut. We tried to make that a point of emphasis. What we're doing in terms of municipal aid going forward, holding everybody harmless there, plus another $100 million that we're getting out of CARES Act, as well as bonding, going to those 25 most distressed municipalities as a down payment on pilot and a more progressive pilot payment, the likes of which Marty Looney's been talking about. You know, a good idea. Healthcare, what we can do to continue to bring down the high price of healthcare, make it more affordable and accessible for each and every one of you and our small businesses. Probably the most interesting there is something I'm doing with Charlie Baker in Massachusetts, a cap on increases in pharma prices, drug prices. That has been one of the fastest increasing pieces of our healthcare costs. Let's deal with the underlying costs of healthcare. That's how you bring it down for everybody. And finally, we'll spend a few more minutes on this, full funding of education plus some. What that means in terms of a opportunity for our kids who has some catching up to do after a COVID interrupted school year, and what that means in terms of helping us to hold down property taxes. Next up is investing in our future. Last year and this year, we're spending a lot of time on transportation. We have a transportation fund that's slowly going to be underwater over the next few years. We've got 2 more strategies for the legislature to consider. We can talk about those in a minute. Transportation Climate Initiative, as well as a highway user fee on big tractor trailer trucks that would raise us enough money to make real investments. And secondly, what we're doing in our budget as regards IT, telecommunications, broadband. I think we have found loud and clear over the last year of COVID that we're more dependent on broadband and IT and our Chromebook or iPad than ever before. It's not just so you can download a movie or a song or buy something on Amazon. It was absolutely key to education and telehealth and telecommuting. A big strategy to roll that out so nobody is left behind there. Modernizing state government, something that Josh has been taking the lead on over at the Department of Administrative Services. with a big focus on our IT, information technology, and ways that we can deliver better service at less cost for our taxpayers and users. And finally, economic growth. We've been flat as a pancake for many years in this state. No longer. Our economic growth is picking up. 46,000 new jobs registered online in the state just during the last year. That's amazing good news. But economic growth only matters if it's prosperity for all, and that's a focus in this budget. And that takes me to education, which is the great escalator for everybody, giving them that opportunity. I think what's interesting here is, look, you can see that we had a fair amount of federal money that came in, big priority on education, and the feds have been generous in that front. So in the $265 million we had in this this current fiscal year, we did a lot, especially in terms of making our schools safe, especially in terms of what we could do in terms of disinfecting and masks and testing, and what we were able to do in terms of IT, make sure that Connecticut was the first state in the country to try and bridge the digital divide so no kid is left behind. Fiscal 22, the next coming fiscal year, starting July 1, we should see a 10.5% increase in funding for our schools. That's, again, primarily due to the federal grants that we're getting. I know there's been some discussion about that. $440 million spread over 2 years, 220. And it's worth remembering that our major cities, for example, will probably see a 15% increase over and above what they would have gotten under the ECS formula, which is extraordinary, and probably $20 million overall, give or take, for most of our major cities, and lesser amounts for our smaller towns. But every town and city will be held harmless or see probably a significant increase in the amount of funding that goes to education. I was talking this morning to the incoming Secretary of Education. Melissa has sent, State Department of Education has said guidance to our superintendents of schools. Now's the time to be thinking creatively, because there's a great deal of flexibility how you use this additional money, how you use this additional $220 million a year. Making sure you make up for sort of lost time, thinking about a 12-month school year, thinking about a really ambitious summer program. Look, I love IT, but do you think about a summer program for kids who haven't had a chance to socialize? Miguel was saying, think about the outdoors, think about our aquariums, think about our museums, think about ways that summer education can be fun, socializing, and help our kids get back up to speed. I thought that was really good information, and also a bit of advice. Think about the kids with disabilities. Think about them, because they've been particularly hard hit by COVID. This is an opportunity. We've got resources to back you up to make sure no kid is left behind. Next up is our human service providers. I heard Melissa taking some questions on them. They've been heroes. They've been heroes over this last 12 months. And we need them going forward as well. What they've meant in terms of social services, the number of people who have been isolated and quarantined, the incredible distress that's putting on people, what we've had to do in terms of other services related to the COVID pandemic. So this current year, we had a 13% increase for our not-for-profits. And we were able to provide all the PPE they needed, help them maintain their adequate staffing levels. Some of them lost some of the service-related revenue because they weren't able to do face-to-face contact. We were able to make up on that as well. We've got an increase scheduled for this coming year for the not-for-profits as well, probably in and around $2.7 billion, but I think that's over and above what we're going to see coming from the feds over the course of the next 30, 60 days. That state and local aid will be able to show our commitment to the amazing not-for-profits who've been taking care of people in this time of need. Quickly, we also have a capital budget. I earlier made reference to what we're doing in terms of transportation. I think in 2023, you're going to see we have additional money coming from the feds as well. I think we're looking at additional trains on the Waterbury line, back and forth, more capacity there, trying to speed up transportation on I-95 through Fairfield County, right up through Meriden. A lot of the programs we talked about last year, and ways that we now will be able to fund that through TCI and through the highway user fee. Broadly, in terms of bonding, 1.4 plus billion a year in terms of authorization. Again, we've got 50 million more in terms of municipal aid to get going on the pilot program. And secondly, a big emphasis on economic development. Give us your best ideas there. And affordable housing, especially affordable housing in the downtowns and transit-oriented development. I want to make sure that this is a society where everybody has a chance to have a roof over their head and a great education. And that's what our budget is all about. And finally, transportation. I think this is just very quickly. You can see what we'd have to spend in terms of transportation if we don't get the enhancements I mentioned to you in terms of Waterbury, in terms of speeding up transportation, fixing up our trains and the such. And the Transportation Climate Initiative, as you know, is something we're doing in association with fellow governors in Massachusetts and Rhode Island. It's a fee for the wholesale users based upon the amount of pollution that they produce. That would generate about $80 million, $90 million a year for the state of Connecticut, which we can use to speed up public transportation. And the highway user fee, just on those biggest tractor trailer trucks that come through our state, creating the most damage. Same fee as they already pay in New York and Oregon and beyond. We'd mirror that, and it's a way that we can keep up with our transportation infrastructure, which is so key to economic growth. You know, with that, Josh and Paul are here. Melissa's been working hard, but she's got some energy for a few more of your questions. Over to you, Max.
News 8.
Afternoon.
3.
Thank you, Max.
Oh, go ahead.
Sorry about that. Governor, just one question regarding with vaccines, because there just always seem to be a lot of questions. And one thing that came up was, okay, I'm 65 and I'm a resident. I can get vaccinated. However, I tested positive within the last, say, 2 or 3 weeks. Does that person have to wait?
I don't think so, but Josh, you want to take that?
Yeah, in those types of circumstances, we recommend people consult with their physician in terms of the right timing to get vaccinated if they're coming off a recent infection.
So there's nothing, though, set in stone that if you have, say, tested positive within 30 days or 28 days, because I think that was what came out of New Haven yesterday, that you had to wait a certain amount of days before you were to be vaccinated.
Yeah, there's nothing carved in stone, but again, we recommend people talk to their doctor.
Okay, and Governor, we know of Northern Correctional, and you spoke about two other facilities being closed. Have you named those other 2 yet?
Paul, have we named them yet?
No, we have not officially named those facilities yet, but we have under our projections, and I'll have Secretary McCall talk a little bit more to have 2 additional facilities in addition to the biennial budget.
Thanks, Paul. Our biennial's budget includes savings of approximately $20 million in the first year and $47 million the second year. It reflects the closure of 3 facilities. The next scheduled facility will be announced closer to January of 2022. We have a protocol that we follow to ensure that our state leadership, as well as our unions and our employees, are noticed before a public announcement. So look forward to additional updates as we progress through the calendar year.
Thank you.
Fox 61.
Governor, for those listening, can you confirm exactly who is next in line for the vaccine after those ages 65 and older are completed? And any update on when those specifically with underlying health conditions will be able to be vaccinated?
Yeah, I mean, we just started the 65 and over, so it's going to be at least a few weeks, depending on the uptake and depending on the supply of vaccines. You know, after age 65, we're thinking about age, we're thinking about essential workers, but more specifically to your question about people with pre-existing conditions, I think we're going to have doctors, for starters, reaching out to those patients they've had that have some sort of a high-risk situation, and make sure they're prioritized in terms of getting vaccines. Absolutely.
Thank you. And then the biggest revenue drivers in the budget, legalizing marijuana in sports betting. Can you talk about how much money is expected to be brought into the state from those two?
I can just tell you, we're still negotiating on the sports betting and the iGaming, so we'll have a little more detail on that. And marijuana is subject to passage, but probably not much in the first year, a little more in the second year. But you have something there, Melissa?
Absolutely. The governor was spot on with respect to sports betting and iGaming. Still under negotiation. We have a soft estimate of approaching $50 million in the second year. And with respect to recreational cannabis, the program would start in May of 2022. So through the biennium, starting in fiscal 23, we would have revenues of approximately $33 million, which would take some time for those revenues to increase. We are expecting that after fiscal 2023, we would provide 50% back to municipalities that have been disproportionately harmed by cannabis use and enforcement. So program starts May 2022, some small revenues through the biennium and expected to grow thereafter with funds being reinvested back into the communities that have been impacted.
Great, thank you.
Channel 3 Eyewitness News.
Yes, Governor, taking a broad look at the state, we're seeing the positivity rate, the hospitalizations, they're all trending down over the last few weeks. Is the vaccine the driving effect here? Is it immunity?
I think those are two things. I think we had probably a fair number of people infected. We may not even have known it, so they have some antibodies. Obviously, we're up over, about 12% now in terms of people who have been vaccinated, particularly those who are at the highest risk. That makes a big difference. And there seems to be a certain sine wave to this. Maybe the Northeast and around the country is all going through the same type of process, but it is on a downward trend, not only in the Northeast, but most of the rest of the country as well.
And my final one, you hinted at this on Monday that some of the executive orders could be revisited, maybe dropped. New York is going to be opening up indoor events in March to crowds of 150. You got a letter from several Connecticut associations and industries asking you to do the same. Is that something that you're going to consider?
These are the type of things we are going to consider. We just figured, we just had Super Bowl. We're watching the variants. It's been, a week or two. I think early next week we'll be in a position to make some clear direction on that.
NBC Connecticut.
Good afternoon. I wanted to ask you about this buddy system that Massachusetts has instituted, where even if you're not eligible for the vaccine, you can still get one if you're accompanying someone who is, say, the adult child who is taking care of a 75-plus-year-old patient or parent. Any thought of doing that here?
Sounds complicated. What do you think, Josh?
It does sound complicated. We are fortunate that many of our towns are setting up similar programs to provide transportation for people who need assistance getting to a vaccination site. We're also providing support through the state. If anyone is having trouble, if you're 65 and above, you're eligible to get vaccinated, you get your appointment, and you need help getting to a vaccination site, please do reach out. Start with your local health department or your local municipality. If you're still having trouble, call 211. But I don't think we need a program like that to ensure that everyone has access to a site.
Okay, and speaking of access, yesterday the state released data showing the racial disparity of vaccination in our state. So what are you doing going forward to ensure that people of color do have equal access to the vaccine?
Well, I'll start. I think you know how big a priority that's been going back in time. Look, we found during testing, for example, that a lot of people would go through the drive-through testing, were very enthusiastic about it, often the worried well. We want to make sure that those who are more hesitant about getting tested, now those getting vaccinated, will make an extra effort to bring the vaccine, first bring the test, bring the vaccine to them. You probably saw the big program we have with the churches, in particular the African-American churches. A few months ago we would bring the testing van there. Now we're bringing the vaccination van maybe the minister gives people a heads up at the end of the service. It's safe and effective. Do it for your community. You maybe saw during the Super Bowl, the public service announcements we had. We're working this pretty hard. What else, Josh?
Now you hit on all of it, Governor. I mean, this is a national challenge that we're seeing, and as the governor's been talking about this in almost every press conference for the last month, I think, knowing that we didn't need to wait for that data yesterday to know that this was going to be an area where additional focus was required. So, we're focused on the three legs of the stool that you need to get right. Number one, making sure that every vaccinator who's doing community outreach, doing mobile clinics into hard-to-reach communities or communities that have been disproportionately impacted have the vaccine that they need, that they're not held back by the supply. We're taking care of that. We need to make sure that we've got the access, and this is a town-by-town, city-by-city effort that we're partnering with our local municipalities, local health departments, all the providers, all the community groups on the ground to make sure that the access is available. And then we have to address the hesitancy too. We're aware that there is hesitancy in certain communities, and we're, as the governor said, getting very aggressive on outreach, on education, working with all channels we can, all community partners to get the word out about how safe and incredibly effective this vaccine is from ensuring people don't get sick.
Okay, and lastly, do you have an update on whether vaccinated people will have to follow the travel advisory? Will you follow the CDC's new guidance that those who've been exposed but have been vaccinated don't have to quarantine?
Yeah, this is an area where we're going to be looking for some guidance from the federal government. I think a lot of states are asking similar questions right now about how people who are fully vaccinated, may be able to, have different, restrictions applied. At this point, we really need the CDC, though, to give us guidance on that.
Thank you.
News 12 Connecticut.
Hi, everyone. Governor, do you have an update on the number of variants that have shown up in the state? It's been a while since we got an update on those cases.
Do you have that, Josh?
Yeah, well, the State Department of Public Health had announced over last weekend that the count had grown to 20. Fortunately, we've not had any additional cases identified as one of the B117 variant since then.
Great. Melissa, if I could follow up on the prison question. I know you said that you're not going to announce any additional prison closures until January, but the new DOC commissioner, when he was testifying a few weeks ago, said that he would be naming an additional prison by mid-February. So I just want to be clear that that announcement's not going to be made now?
No, he was likely referring to the first closure, which was Northern. And after we have a process that we follow from a collective bargaining perspective to make sure that our union officials and our employees are aware, that's likely to be several months out before you hear of the next one. And just for clarification, we announced one in February, we'll announce one in July, and then we'll announce another one in January. So you're probably a couple months out before you hear from the commissioner on the next closure. At the end of the day, we're really focused on facilities that have low occupancy rates, where we are spending an operating cost and personnel, and yet we're not fully utilizing the facility. So stay tuned for further updates from the commissioner and the governor's office on that.
Okay, thanks for clarifying that. And Governor, this one's directly for you. I asked Melissa this yesterday, but I want to get your take on it. The trucking industry is looking at this new mileage fee and saying, hey, you couldn't get tolls passed last year. How is this not an end run around that?
Look, the big tractor trailer trucks cause, overwhelming amount of the damage on our roads. And they're coming up from outer state, driving through New York, driving through other states where they either pay a toll or they pay the highway user tax, or in the case of New York, they pay both. And I just think it's appropriate that when they tear up our roads and they come through here, they make a bigger contribution. I think we've done this in a way that is doesn't require a lot of new technology, doesn't require a lot of capital costs. We can get it done pretty quickly. It would raise real money that we need to A, save the transportation fund, and B, make investments to get our state growing again.
But if there wasn't enough support in your own party to get this passed last year, what makes you think it has a chance now?
Reality sets in. We've got to do something with the transportation fund. We can't stick our head in the sand. A lot of people thought tolls was complicated and they were all over the map. Here it is, just for tractor trailer trucks by law. And I think it's about $20 to drive through the state of Connecticut.
So just to pin you down on this, you're committing here and now that this would not expand to cars in any way.
You can write that law any way you want to, legislature, to give you 100% confidence there. Absolutely.
Thanks, Governor.
Yep.
WTIC 1080 News.
Hi, Mr. Governor. You're used to taking criticism from conservatives. What do you make of progressives criticizing aspects of your budget?
Look, we've got a lot of additional investments in education, a lot of additional investments in our not-for-profits. We're not only holding our municipalities harmless, we put money in place for them as well, and that's before the state and local aid that I think will be passed by the Biden administration. So I just tell everybody, slow down a little bit. I think we're in a place right now we're going to be able to take care of people during what's been a horrendous 12 months. We're slowly digging our way out of this pandemic, getting people back to work. Our kids are back in school. And we'll see if we need to do anything else a month or two from now.
And back to COVID, do you have any update on vaccine supply? Last week you said it was on the upswing. We did have a clinic or two where they had to stop for a time. Has that been resolved, and is supply picking up?
Well, we've talked to the manufacturers. I know they're negotiating another 100 million doses with Moderna and Pfizer. We have not gotten any indication yet from the federal government when we might see those additional doses, but I'm very hopeful.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, you mentioned that doctors would be reaching out to people with a pre-existing condition. How is this program going to work? Would people need a doctor's note to prove that they have one? I just wonder, will it be an honor system?
I don't think it's an honor system, but I do think that you'll be able to set up an appointment at Hartford Health or Trinity, wherever you maybe are, and your doctor would help get that arranged. Josh, do you have any more thoughts on that?
Yeah, as the governor mentioned, we've got about 3 weeks to 4 weeks before we get to that next phase, and we'll certainly be providing a lot more specific guidance well in advance of by the time we get there.
And Josh, maybe this is for you. What did you learn from the testing rollout in terms of trying to reach out to minority communities? Was the social vulnerability index used back then like you guys are using it now to try to gauge the levels of vaccinations?
Yeah, we learned a lot from that process that we're leveraging now, both in terms of the community partners that we can work with, both on the provider side, as well as on the kind of outreach and education side as well. And so we're partnering with many of the exact same people that we worked with to scale up our very successful testing program now on vaccines. So there is a lot of commonality there, Sue, in what we're doing.
And one last one, thanks for that. Where do things stand in terms of vaccinating inmates and correctional officers?
Sure. So Commissioner Quiros and his team are about halfway through vaccinating the correctional officers. That's been going well. And they are also about halfway through vaccinating incarcerated persons who are 65 and above. Actually, just before we came on the line, he shared with me an incredibly wonderful bit of news, which is of the first 204 incarcerated persons who are 65 and above who've been offered vaccine, 200 of them have accepted. So 98% acceptance rate, which is really fantastic news.
Wow. Okay, great. Thank you so much.
The Connecticut Mirror.
Thanks, Max. Couple questions. In the press release that came out yesterday talking about the issues with racial disparity, it mentioned that there was going to be a 10% increase in allocation to communities that are on the SVI index. What's the total percentage of our weekly allotment that's now going to those, what you consider to be the SVI communities, if you have that, Josh?
Yeah, so the communities that are 75% or above on the SVI represent about 60% of the state's population, and prior to that had been receiving about 75% of the doses to locations in those cities and towns. So that would be in addition. That's obviously providers in those cities, not that, they serve and help vaccinate people, beyond as well. But what we're really trying to do is make sure it's as convenient as possible for people in those high SVI towns to have access to vaccine.
I mean, do you have a sense why some, I'm thinking New Britain and Bristol off the top of my head, but why some are lagging behind others? I mean, Stanford's done great, New Haven's done great. I'm sure you've studied what's going on in some of these cities that seem to be lagging a little bit behind.
Yeah, I mean, as we've discussed, each city is a little different, and some get organized a little faster and more aggressively than others. And there's some areas where we need to step in and help out, help bring the parties together to get things moving. But I think we're seeing progress across the board, and we're optimistic that we'll have access available for everyone who needs it in those towns as well.
And one last question for the governor. Governor, I noticed that the Department of Public Health budget's pretty flat, which kind of surprised me given that the Mathematica report pointed to the fact that they were short-staffed to some level when the pandemic started. Any particular reason why they don't seem to have much of an increase in the DPH budget?
I think I'll pass that one over to Melissa, but I think you're going to see there's some CARES Act support there that supports public health, including the Department of Public Health. But Melissa?
Thank you, Governor. You are spot on, Governor. The Department of Public Health has received considerable resources from the federal government. In the most recent CARES Act funding, they received over $200 million. It will support testing, contact tracing, detection and mitigation. They've received prior stimulus dollars to help with technological resources for the labs, as well as for data systems in terms of how they manage public health pandemics. The feds have been very focused on providing resources to strengthen our health departments. And so for that reason, the department did not see any need for additional general fund resources. We will leverage our federal dollars. And if there are any gaps thereafter, then certainly we'll consider general fund support. But there's quite a bit of work to do that they've been tasked by the federal government and resources to support it. So they're in good position to strengthen the department and their responses in the future.
Thank you.
The Waterbury Republican American.
Thank you, Max. A real quick, budget question. I was listening to Waterbury Mayor Neil O'Leary testify for legislation that would authorize, funding for more prisoner reentry centers. They're looking to establish one in Waterbury. I looked through the budget and I didn't seem to find anything in there, but I could obviously have missed something. Is this something that the administration is contemplating or is reflected in your budget, additional funding to establish more community reentry centers?
Governor, I'll take that one for us. We did not specifically add any supports for reentry. We do have funds in the budget to support the Project Longevity program within Waterbury, which is a part of their criminal justice efforts. But Waterbury is one of the 25 distressed municipalities that will receive additional funding under the governor's proposed budget. And it's certainly if they felt it was important to invest in reentry, Waterbury is going to receive an additional $9.7 million in fiscal year 22. So they could certainly use some of those additional muni aid resources to support those efforts.
Okay, so that funding is not tied to COVID response then?
50% of it is tied to COVID response, and the other 50% has some flexibility.
Oh, okay, thank you. And I guess this might be a question for Josh or the governor. The DPH analysis that was released yesterday stated that this was not going to be information that was going to be reported regularly. We've certainly heard a lot about the trust gap, and this information could help in letting people know what's happening in terms of vaccine coverage. So are there plans to at least periodically report this information? I realize it's there's challenges in gathering and reporting it, but.
Yes, we will provide updates from time to time. Absolutely.
All right. And in terms of the correction officers, what is the vaccination rate among, well, not just the correction officers, all prison staff? Because I think the survey we had reported maybe a week or two ago, I think it was about 50% maybe. I can't recall off the top of my head.
Yeah, I think we'll probably report back on that maybe next week after they've completed the first round. I do know that just over 1,500 correctional officers have been vaccinated, but that's a subset of the facilities, and they're still working through the rest of them. So we could provide a more complete report next week.
Okay. And in terms of vaccination administration, is it ever going to be the case where, say, much like businesses will have a flu shot clinic, will there be, as we progress, will there be opportunities for, private companies to arrange sort of COVID clinics?
Well, I think for the next couple of months, we'll be very focused on providing access to broad segments of the population as quickly as we can, with a significant focus on equity and how it's being distributed. I think after 2 to 3 to 4 more months, this is going to pivot to a point where everyone who wants the vaccine has gotten it, and now we're trying to help drive rates up even higher beyond that. And at that point in time, I could imagine all sorts of creative possibilities like you described, Paul, to make it is even easier for people, in workplaces and so forth to get vaccinated.
And just one last kind of a reader question. We're being asked why doctors can't administer these shots. And I thought you guys had mentioned in the past that has something to do with the refrigeration, at least with these 2 vaccines, but I'm not sure. So
we can get back to you on that.
Okay, thanks. Appreciate it.
CT News Junkie.
Thanks, Max. We've got quite a few questions from folks representing people with disabilities or their caregivers, as well as unpaid caregivers for elderly people. I know you've sort of said, Governor, that or suggested at least that maybe the critical workforce people would be next in line. Maybe where do we think that this population might fall?
I think they are a priority population. We'll have to figure out how we get people prioritized in the post, 65 and above age group. Obviously, folks with a particular health disparities, we're going to make sure they're prioritized as well.
Thank you.
The Hartford Current.
Thanks, Max. Governor, it came up at appropriations today that some of your fellow Democrats said that there's not enough equity in the budget and basically not enough money and opportunities in the cities. Can you tell us your views on that?
Every city, we got $100 million set aside right now for our distressed cities on top of Muni Aid that is going to be at least as much as they got last year. I think you've seen in terms of education funding, especially for our cities, they're going to see significant amounts of additional resources going forward. I think you're seeing that we're making a big commitment to our towns and cities to hold them not just harmless, but provide them all the support they need to power through COVID. On top of that, with the CARES Act money, what we did for the local businesses there, keeping them propped up, what we got for rent relief so that landlords and tenants, people can stay in their home, landlords can continue to be able to afford to pay property tax. ECS funding, making sure there's more funding there, that's a big driver of property tax, able to hold that down and keep our cities whole. I'm pretty proud of the budget we've put together.
Also, you set aside $40 million for the Yukon Health Center. That is a long-running issue, as you know, in which they've been bailed out multiple times in the last 20 years. What are your long-term plans for Yukon Health Center?
I got to think about that. It's a beautiful facility. It's a little small, maybe, to be totally economic. It's got some very heavy legacy costs, which makes it not that competitive. So we are taking a look at Yukon Health.
But this year, you feel the $40 million is enough?
Yeah, Melissa?
We do. In fact, in fiscal 21, we currently project about a $50 million deficit. That reflects their shortfall in fiscal 20 because the legislature wasn't in session. We didn't have a deficiency bill, and their current projections for fiscal 21. And then as we go into fiscal 22, Yukon usually starts with a higher number, but they're great at doing some mitigation to drive down costs. They're starting to rebound. They've restarted their elective procedures. We're seeing improvements in their revenues. So we feel confident right now that 40 million is the starting point. And as we do every month, we will monitor what's happening with their projections on the ground, and we'll adjust accordingly. I think we're in a good starting position.
Okay, thank you.
Hearst, Connecticut Media.
Yes, hi. Thanks, Governor. The Washington Post reported a while ago that the Biden administration is expected to announce 200 million additional doses have been secured. It's Pfizer and Moderna. Is the amount that Connecticut can expect to receive still about 1% of that figure? And is that going to change the calculus at all of how it's distributed here?
We usually can estimate about 1%. It generally is per capita. I'd love to see what the timing on that is. You know, Josh and Deirdre and the team, we have the infrastructure to support a lot more doses than that, both in terms of mass vaccinations and going after the targeted and underserved communities. I think that's extraordinary good news. It helps us get through the 65 and above age group a lot faster and move on towards essential workers and younger people.
Thanks. And then actually on that, I just want to clarify, is it going to be essential workers next, or is it going to be people with underlying conditions, or both?
Give us a couple of weeks. We're talking to CDC. I'm on with the head of the COVID task force in the White House yesterday just to get a little more guidance in terms of how we want to do it. I've seen other states where they just open it up to everybody. It's a free-for-all. You try and sign up online. It's jammed up after about 3 minutes. That's not the way we want to go. I think it's worked pretty well by appointment on a process as we slowly open up by age group has made a big difference for Connecticut.
Thanks. And then one more. The CDC had some recommendations about double masking that came out the other day. Are you wearing 2 masks whenever you go out, or what's your take?
No, I wear 1 mask at this point. If you feel more secure wearing 2 masks, it's probably a pretty good idea. I'm happy that Connecticut people are more likely to wear their 1 mask than just about any state in the country, and that's a good thing.
Thank you.
Hey, thanks, Peter. Look, I just wanted to say, one thing in closing. Josh and Paul, thank you for what you're doing. And Melissa, we got 2 women who have been superstars in our state over this last week. One is Melissa McCall. She has been jumping through hoops. This is probably her 6th briefing as regards the budget. She's a walking encyclopedia on these numbers, putting in place a budget that reflects our values in our heart and gets this state moving again. And, talking about shots, there was another shot, I think, heard round the country. It was on a Monday night. It was Paige Beckers from the Yukon women. It was a shot in the very end of the game against South Carolina to put it on ice. It made Yukon women the #1 female basketball team in the world.
Open it up to Nelson Adoda. Back to Beckers, who will let it fly. The magic. Final few seconds.
There you
South
go.
Carolina's got a hustle.
That was nothing but net. That's good, Max. That was nothing but net. That's the shot in the arm for the state of Connecticut. Nice going, Paige. Nice going, Yukon women. Take care, everybody.